that might contribute to you get. Hey guys, so welcome to part 2 of the interview stage video. I did feel like breaking it down into 2 would be helpful. What I'm going to be doing is talking about the different categories of questions that you could be asked in the interview. And I'm not disclosing questions that I've been asked in my interviews. You sign the thing where you're not allowed to tell people about what kind of questions came up. And I'm going to be looking down a lot because I've written loads of notes about this. So the first category would be questions about the university or the course. Now for this you need to do research on the university and the course and find out things that they might talk to you about. For example, the teaching style at the university and why it's different to other universities, and maybe when they start to introduce you to patients, start to get you to learn clinical skills, because it's all different at different universities, and that might help you answer the question, why do you want to come to this university? Go to an open day if you can, because obviously that will give you a better idea of the university and hopefully it'll give you more to talk about if you can mention the fact that you came to the open day, which will show that you really want to come to this uni. Part of this category would also include what you have to offer to the university. So you need to show them that you're a good student, and you need to talk about what kind of skills you have, what kind of societies you would join, what kind of extracurricular activities you would do. Basically, how would you give back to the university? And this is a chance for you to kind of show off. So use that chance, because that's why they've asked you the question. So next category would be questions about yourself. Now this can range from why dentistry to do you like to read? So all I can really say for this one is you need to be honest and you need to remember what you wrote in your personal statement and make sure it's true. So if they ask you anything about yourself, you're not sitting there like, what? Did I do that? It's a chance for you to show off, but don't be arrogant and don't be cocky, and only talk about things that are relevant. And most importantly, like I said in my last video, don't be so nervous that they can't see your personality. Relax and let your personality shine through. Okay, so the next category would be ethics-based questions. Now dentistry is a profession that involves ethical dilemmas. For example, you always need to put your patient's interests first, confidentiality, working in a team with your colleagues, maintaining integrity of the profession. So what you need to do to prepare for ethical questions is maybe make a brainstorm of the qualities that a dentist would need, and then remember these qualities when it comes to answering questions. And remember, for these kind of questions there is no right answer, as long as you give a balanced argument and you highlight all the issues that you can see. That's really all the interviewers require. Remember, when you answer these, only give your opinion if you're asked for it, and make sure your opinion doesn't dominate your answer. Like I said, you need a balanced argument. So ethical questions can be about money, cheating or lying to protect yourself or someone else, confidentiality relating to a patient's age, for example, empathy versus sympathy, someone's right to treatment, things like that basically. So just go over that kind of stuff. I would say visit the GDC website and just have a look at what they have to say about ethics, and brush up on some terms such as Gillet competence. That might really impress your interviewers if you know what you're talking about. So next category would be science-based questions. You would be expected to know some aspects of science that relate to dentistry. I would say for this one, read up on topics. Firstly, read up on common diseases such as cancer, heart disease, stroke, HIV or AIDS, and diabetes, as those are most likely to be brought up. Also read up on causes of diseases such as smoking, genetics, other environmental factors that might contribute to you getting a disease, such as lifestyle. Read up on ways to diagnose a disease / treatment, so like radiotherapy, MRIs, ultrasounds, just basically how they work. And read up on dental materials such as amalgam and fluoride that are talked about a lot nowadays, but I'll talk more about that. It's in another category as well. And like I mentioned before, if you don't know the answer, then just say you don't know the answer, but say that you will give a try. Don't just sit there and be like, I don't know. You have to say, I don't know, but I'm gonna give it a try. So next category would be dentistry based questions. Now, like I said, you're not expected to know everything about dentistry. You don't need to revise for your interview. Like, you do need to prepare, but it's not an exam, so don't worry. Just educate yourself on the basics. Read up on diseases related more to dentistry, such as gum disease, oral cancer, periodontal disease, oral hygiene and oral health, and then read up on dental materials, like I also mentioned, such as amalgam and composite, such as dentures and things like that. Basically, like, you don't need to know too much, just know the basics. And like I said, they don't expect you to know everything, so yeah, just read up on what you can read up on and make sure you understand it, and don't talk about something if you don't understand what it is. I've still got 2 more categories left. This is why I split the video, because I know it's going to be really long. So the next category is dentistry in the NHS based questions. So again, you don't need to know everything about the NHS, you don't need to know about everything about dentistry, just have an idea of it. For example, the background of the NHS, when was it founded and why was it founded, what is free under the NHS and what isn't free under the NHS. The 3 main things that aren't free are prescriptions, dental services and optical services. Get an idea of how the NHS is paid for and how dentistry under the NHS works and how are dentists paid if they work for the NHS, and just get a good idea of private versus NHS dentistry as well. Also brush up on the issues within the NHS. Now, I know this is a lot to go over, but once you kind of read about it and you have an idea about it in your head, it will be easier. If a question comes up in your interview, you will at least have a little bit of a clue. And finally, the last category, which is current affairs based questions. Don't worry about this one too much, because again, you're not expected to know everything, but if you do have knowledge of current affairs, it's just an extra for you, and it will obviously impress your interviewers. Read some medical articles and only talk about the ones that you understood and the ones that interested you. Go over some recent advances that have been made in dentistry and medicine, and go over how technology is affecting dentistry. So I think that's it for this video. I know that was a lot to cover. Don't ask me about what the answer to the questions are, because all you need to do is basically use this guideline and do your own research, and you should be fine for the interview, whether it's panel or MMI. If you have any other questions, then just email me. Good luck, guys!